Good afternoon to all of you. I'm Idina Bond and I'm the founder of Medi-Gyn Center, a hormone balancing center that is based in Dubai, originating from the south of France and Monaco. And we offer hormone balancing solutions for women and men too. In addition to hormone balancing solutions, we also offer regenerative medicine as well as functional medicine and integrative medicine, sometimes it's called. So today we have Dr. Nahla with us, a gynecologist, bioidentical hormone specialist, as well as sexual health specialist. And Dr. Nahla, we will be talking about the truth and nothing but the truth about sexual health, what's happening to women and men during their menopause or andropause in the way of libido, as well as for ladies other aspects of urinary tract health, right?
Yes, right. Good afternoon. Hi, everyone. There is a truth about the vaginal health and penile health about the hormones and the relation, and we just want to clarify it. And so today we need to just put some points and to light some issues about those aspects.
Yes. So, as we know, a lot of us know that menopause it's about hot flashes, night sweats, but also a lot about sexual health, our libido that is going down and down, our feeling, let's say, down there is changing during this time. So, what is the reason for all of it?
The reason and the only reason is the estrogen deprivation. When you have a low estrogen, you have a low collagen in your vagina because our vagina is rich in the receptors of estrogen for a reason. It's because this is what make rejuvenation of the vaginal tissue along with
Yes.
the urethra and the bladder. So imagine if you have a low estrogen, so you are depriving your vagina and urethra and bladder from the collagen that keeps the muscle healthy. So
Yes.
now we are having unhealthy tissue. You will get like incontinence of urine, you will get vaginal dryness, you will get lots of pain during sex that we are calling dyspareunia, and all this stuff will lead to a feeling of discomfort, like you're feeling your vagina is something that became an old house that we are calling, or something that you feel like it makes you a trouble instead of being the strawberry of your body. No, now it's this strawberry needs to be a little bit more freshener. So this is all estrogen.
So estrogen decline leads to various issues, various urinary tract issues for women, but also various issues in men too. So first, let's talk about women.
Okay.
Because
it's always women first.
Always women first, and that's the key for us as well. To make sure that it's not taboo anymore, let's shed some lights on women's urinary tract, let's say, issues. So, for example, what can we do for a woman as its estrogen declining day by day from the age of 35? In your professional opinion, will women face various changes from the age of 35, or perhaps it will happen a little bit later?
No, what you said is very good because sometimes women say that I have a regular cycle. I'm still young. I'm not 40 or 45 yet. I'm still in the 30s. So my estrogen is good. And then she will have some urinary issues and some libido issue. And the last thing she will think about that your estrogen is declining since 35 years old.
Yes.
This is nothing related to your regularization of your cycle or the other symptoms that we all know about menopause.
Yes.
So you'll have the decline of estrogen. What to do? Just go and have a consultation. This is the first thing. If you have some urinary trouble, you go to the toilet too much than normal, like we are saying, it's a frequency. You're having too much urinary tract infection and it's recurrent even with taking antibiotic. You cannot control anymore your urination, even like your doing gym, you're sneezing or coughing, cannot control it anymore. If you just have the feeling of urge, no, you have to go now to the bathroom, and this is a big question mark. Go and check your estrogen, and let's see it from there.
And the majority of the times, the estrogen will be lower than usual, right?
Yes, for her age.
For her age.
Although other symptoms are not there. She has a regular cycle, she has a good ovulation, but her estrogen is low.
Yes, yes. What about our bladder? Because the bladder is also the bladder mechanism. Apparently, it's affected too with estrogen decline.
Yes, because of what we call it, the musculature, the muscle itself of the bladder is full of collagen, and there is a receptors, and there is a link in the genitourinary tract of the woman, link it to her uterus and to her vagina. So since birth, it's all linked together. So even the estrogen will affect it, and will affect the strength itself.
Yes, and that's where we come into pelvic floor.
Yes.
The pelvic powers.
Pelvic floor muscle is the most important. And
Yes.
it's always very weakened as anatomical with the birth, with increasing in weight, but also with the estrogen.
Yes.
Because estrogen is all doing the collagen thing in our genital tract.
So mechanically or structurally, all the aspects are affected due to estrogen decline.
Yes.
Yes.
And even the inflammation, you know that if we have a low estrogen, you are prone to inflammation, even if it's your teeth. What if it's your vagina and your urethra and your bladder?
Yes.
So the estrogen as an inflammatory
anti-inflammatory agent.
Anti-inflammatory, yes, it's very important.
Yes, yes. And ladies, just for some of you who don't know or perhaps forgotten, estrogen and especially estradiol is one of the most antiviral, anti-inflammatory hormone in our body. It's a female hormone that is super potent during our reproductive age. And the minute we are getting into 35 plus, it's diminishing day by day.
Yes, diminishing. And if you have any symptom not related to menopause, please consult a gynecologist and a functional gynecologist or a hormonal coach to just measure your estrogen. It's only one test, and it will keep you like safe and put you on the track.
Yes. So tell me, please, what do we offer our women? We will come to men a little bit later, but what do we offer our women to support that function, to support all the structural functions, as well as, of course, it's to do with how we feel about ourselves, but first and foremost, structurally.
Structurally, if she has like something wrong with her bladder and urethra, like in a urine symptoms that we are calling, according, of course, to the symptom, according to her estrogen level, we are providing her with the PHRT, and this is very safe even for young women. I don't know why people are afraid, like they're saying we don't want to take a hormonal therapy, but now we're not talking about hormonal therapy, we are talking about bioidentical hormonal therapy,
which is even safer actually than contraceptive pill.
Of course.
So just to underline, it's much safer than contraceptive
and
pill.
not only in the safety, on the side effect itself, like
Yes.
When we are giving contraceptive pills or any synthetic hormones, we are giving a woman something or pills that make her mood swings, make her depression. But if you are correcting her estrogen and progesterone level with a bioidentical hormone, you are treating her mood swings and her depression levels better than the antidepressive.
Absolutely.
So see if two hormones, but one will give you depression and one will treat you from depression.
Yes.
So
absolutely.
It's totally opposite, safety and side effects and everything.
Yes.
Okay.
What are these bioidentical hormones? What are they?
Bioidentical hormones are actually hormones are derived from plant origin we are using it from yam. They are not natural, but they are biologically like the same as our hormones. So we are just correcting the hormonal level in a safe way, and we are giving them in a doses personalized, especially for every woman according to her symptoms and her hormonal level.
Yes. Yeah, exactly. So it's the same, it's identical as our human body molecular.
Yes.
And
exactly.
therefore it's we don't get any side effects. It's very naturally improving your levels of all hormones, especially estradiol,
Yes.
progesterone, and therefore you feel much better. And therefore we can address all those urinary tract issues with those hormones.
Yes, and we can use also other stuff like lasers and radio frequency
Yes.
with the bioidentical hormone to make the result better. And she can feel from the first session, like
Yes.
it will take 1 month, then one or two some of our aesthetic or functional treatment like lasers, and it's totally different than using one method alone.
Yes, absolutely. So this is complementary to bioidentical hormones.
Yes,
We use.
and this is where I'm gonna ask you: do you have any stories? Because I know that you work a lot with women with the hormonal
Yes.
thing. Do you have any story, a real story about urinary thing? You had it with the PHRT, and it gives you a
Yes, it gives you a huge relief. We had a woman recently who came to us with quite severe symptoms of perimenopause. Actually, it's a younger woman, perimenopause. But the most severe symptom of all was urinary tract issues, and specifically urinary incontinence. And we use bioidentical hormone therapy for her in combination with the laser treatment to stimulate those muscles and to make sure that her symptoms are lessens or perhaps disappear altogether. And so far, it's been very successful. So far, we received really great results.
This is amazing. This is really amazing. We always talk about the postmenopausal women, like they have lots of symptoms together.
Yes.
Like they have the dry vagina, the loss of libido, the atrophic of the urethra, and
Yes.
some bladder incontinence. And we call it genitourinary syndrome of the menopause. But few people will know that this might happen to a younger woman without getting menopause.
Yes.
So we're not gonna wait for the menopause because this is where the women are in her the middle age. She's having children. She's having a job. She's having a family, and she's young and she wants to live freely.
Yes, freely and to the fullest. And it's her right to do that. And interestingly enough, we know for fact that menopause nowadays happens much earlier.
Yeah, unfortunately.
And very
you can see
often,
it in 40s.
yes,
You can see it in 40s.
we have
very easily
women who come to us in the 30s to look for some help because they already face the level of estradiol in their blood. It's already quite low. So these days, menopause, as it used to be with our mothers in 50s, 60s.
Now with our sisters and friends.
Yes.
We call it premature menopause. What happened with premature menopause, even if it's naturally occurring or it's a surgically, like she had a disease in her ovaries,
Yes.
and nowadays we can see lots of, we have to do surgeries for uterus and ovaries to remove them in young ages. Either this way, the problem with the premature menopause, the young women who get menopause, is they get all the symptoms more severe than the older women, and they get the complication because they live longer, so they get all the complication. Like they start their osteoporosis, their weakening of their bones when they are 40s. Imagine if you are 40 and you are very vulnerable to fracture.
Yes.
Imagine if you are 40 and you have like this all full of hair of your skin start your buttocks very early. This is really something that we are very sorry for, and we can
Yes.
see it lots these days.
But at the same time, you see, we can help and we can assist with
Yes.
every single system.
And this is what we are doing.
Yes.
Yeah, especially with you. Yeah, and you're one of the people who begin to advise women to speak up about their symptoms. Like it's they don't take it for granted anymore.
Yes, absolutely. Not only can we reduce the symptoms of every single lady, but we can also enhance their life, post-menopausal life and during menopausal life. Be more active, more healthy, because exactly for the reason that we optimize those levels, hormone levels.
And less stress.
Yeah.
sleeping.
And less stress, of course.
Although progesterone is one of the hormones that makes people think that they are very stressed, but it makes you sleep better.
Yes.
It's only one pill you can take, and then you're gonna sleep better.
Well, but this is not a sleeping pill, right?
No, it's not a
but
sleeping
it
pill.
calms you down.
And lots of women, they have low progesterone. I have a regular cycle,
Yes.
so no, but you're not sleeping well.
You're not sleeping well, and you're agitated, and you're
Yes.
irritated, and you are all of this. So absolutely. So let's go back to our urinary, because the topic of today
Okay.
is urinary incontinence, urinary tract issues. So what can we do for our bladder then? Would it be the same treatment, more or less?
No, our bladder will be like the hormone is the major thing. And if we have something related to the bladder itself as an anatomy, we have to do more advanced tests with a urogynecology. And this is a test called urodynamic. And we have to see what's the problem with the bladder itself. Is it new? It's because of the nerves, because of the muscle. But the estrogen also works as the roof of all this.
Strengthen the muscles
because
of the...
this is the main issue about the bladder.
Yes.
Then we can find what the other issue and we fix it accordingly, starting from just Kegel exercise till up to the surgery.
Let's now concentrate a little bit more on sexual health of a woman and vaginal dryness. Vaginal dryness, it's not only doesn't feel that well and that comfortable, but it also really, I think, doesn't give you that confidence anymore, as a woman. And you feel a little bit less of a woman with vaginal dryness.
Yes.
What can we do for such a lady?
Actually, the vaginal dryness is even, we can see it in a young ladies with a good estrogen, but this is because of lots of things, of her feeling toward her husband, of her feeling toward the sex itself, of her feeling about herself as a woman.
Yes.
So it's very complicated, but if you have a dry vagina because of the low estrogen, estrogen can make a miracle from only one use, from the first use. This is a phrase I quoted from one of my patients. Doctor, from this first time, I felt like there is something. I felt first time of my life to feel fluid down from the first time, and even I thought it's because of it's a cream, but then I realized no, she was using it on her hand. It was a liposomal estrogen, not a vaginal estrogen. So I knew that this how much is as if you are very thirsty and you just take a small sip of water, so you feel like, oh my god.
Yes.
So it was that feeling.
And it wasn't even vaginal estrogen, but a normal estrogen, transdermal estrogen.
Transdermal liposomal estrogen, not a vaginal.
But
because in the beginning when she called me and she's telling me this, oh my god, I was really amused. Maybe it's the cream, but then no, it was here in the hand, not.
But ladies, you have an option as well for vaginal creams, and we do use it quite a lot, right?
Yes, I do use it quite a lot, especially if I'm gonna want a real effect and the fast effect for the vaginal dryness. Estrogen is the water of the vagina. I don't know how to quote it, but
the moisture is super needed for.
Yeah, and it's super needed. Whenever we're gonna use anything without an estrogen and optimizing our estrogen level, your vagina will still be dry. And it's not only the dryness, it's the libido itself. Because if you're having a vaginal dryness, you will get pain during sex. It's called dyspareunia. Then when you're having a pain during sex, no one enjoy sex during while he's having pain, so you will not enjoy, so will not reach the orgasm. Then when your husband asks you again, you're losing your sex drive, you're losing your libido because you feel it's like painful. So you're moving in a circle that it became
vicious circle.
Yes, and you are trapped there, and it will always start with taking estrogen, and estrogen will break this circle. It will break it as a moisturizing of the vagina, so it will decrease your pain. It will increase your libido because estrogen is the libido hormone for women, and also it will make the vagina more healthy. So no more infections, no more recurrent dysuria or the pain you feel and the itchiness. So you will feel alive again in the vagina. Yes.
Yes.
You will
Yes.
breathe again. The most important thing about sex in women, the women have this emotional, they do sex because they are recipient of emotion. So even if you don't think about sex at the start, but if you like it, you will do it again. But if
Yes.
you're feeling pain and you're feeling dry vagina, you will have a bad experience, you will not like to do it.
Yes.
It's totally different than men.
Absolutely. And sexual life, we quite rarely we speak about it on our channel, which is wrong, I think, because we should speak about it more and more, especially sexual health after 40, after 45, during all those changes due to estrogen decline. And I feel that sexual life is very important for every single woman.
Yes.
And it becomes kind of non-important purely because of this technicality that we either don't know about estrogen creams or bioidentical hormones, or we are not interested at all due to the previous experiences, right?
Yes, the experience.
Not quite good
The
experiences.
woman will have some experience that she's feeling pain during sex, or for any reason. She feels like she lost libido, and she thinks that this is her. I don't want it anymore, and she doesn't
Yes.
feel like this is a very easy.
Yes.
And also, estrogen works in a libido because estrogen increase the dopamine, and whenever your dopamine increase, your libido increase.
Absolutely.
Anything
Absolutely.
increase your dopamine makes you feel I want this.
Yes.
Increase your desire.
Anything that increase your dopamine, it's also increase your serotonin, it's also increase your oxytocin.
Yeah,
It
oxytocin,
increase
our love hormone. I love the oxytocin.
yes, it's all increase your all the and regulates all your neurotransmitters.
Yes, and this is
Isn't
very
it so?
important in libido and the desire. And but the most important thing again is the experience itself, that the women are recipient. It's like she will have, if you're tasting food and you like it, you will have the appetite also to get it. If you didn't like this food, you will never get it. Or if it make you feel pain, you will never want to
Yes.
eat it.
Yes.
So it's like that. So we need to improve the experience, and we cannot improve it without the vaginal health.
Yes.
We
Absolutely.
cannot.
And estradiol in particular, is the number one
Yes.
helper in
Yeah.
this situation.
Vaginal, liposomal, transdermal. It's amazing. It's amazing in keeping your vagina healthy, keeping you wet, and increasing your libido and enhancing your sex life.
Absolutely, which is very important. So we've talked a little bit about women. What about men? What men are facing after 40? Because there are a lot of men who are seeking for some advice. And we do have men in our center, thanks to our women who bring them over.
Yes.
Which is great. What can we do for our men?
Our men is a big issue. They are big. They are that their testosterone. Oh my God! Even that their testosterone for us makes us more energetic, makes us
dynamic.
dynamic, and it's the testosterone. It's like a fuel.
Yeah.
It's oh my God!
It's our zest for life.
Yes,
Yeah.
you're giving a woman a very small dose of testosterone, of course, bioidentical, and you feel like she's more energetic, she's better concentrating,
Yeah.
and she's having more libido. Okay, imagine a man who has God created him with tons of it. So of course, man, it's the fuel. So when it decline a little bit in men, and because of age, men now they have this andropause. I know it's a little bit commercial thing to say andropause, because pause means a stop. And when we're saying menopause, it's because the menses stop. So for men, it doesn't stop, but it declined. But we just wanted something to make men feel like what we are talking about. So yes, your testosterone will decline with age. After your testosterone decline, you will feel lots of symptoms, like you're not concentrating anymore, you're less energetic, your drive or your sex drive is less, and your erection is not as good as before. Lots of things, even their work ability, like they don't have
Yes.
the passion to work anymore, and they feel like because of the stress and because of the responsibility, but it might be because of your testosterone as well.
Yes.
The penis of the man, it has his penile urethra, and it's also the testosterone that makes the good erection occur and the good tumescent occur. So we cannot live without testosterone for men.
Yes, absolutely.
And any decline will affect him sexually and in urinary issue as well.
Sexually,
And his
urinary.
prostate as
Yes,
Of course, his
and
prostate.
mentally. And yes, exactly. Prostate. What about the prostate
Well,
issues?
our benign prostatic hyperplasia, this term that comes to younger men.
Mhm.
When I was in college, we study it as for older women, for
Yes,
older men, and we have to do these tumor markers to investigate for older men. Now we can see it in a younger man. So this means that the decline of testosterone for some reason makes this man suffer from early prostatic hyperplasia, which make him pelvic congestion, which make him and affect his urine, his sex, his everything. His pain, lots of pain. Of course.
Yes, yes, absolutely. And what do we propose for our men then in that case, if they come early enough?
If they come early enough, even for symptoms not related to urine and not related to his pelvic pain, we have to do questionnaire for him to check that his hormonal level is affecting for other symptoms, because it's very hard for men to tell you that he's stressed, that he's not energetic anymore, he doesn't have any muscle bulk, although he's doing the same gym training as he was doing before.
Yes.
Women are very precise about this thing. They feel their body very quickly. Men are not like that. But he will worried about his sex.
Yes, that's
He
right.
will be very worried. So until he's not affected with that, he will not come to you. So you have to give him a questionnaire and let him answer this questionnaire, and then measure his hormonal level. And there are some binding globulin, very important, that sex binding globulin, and then take it from there. And also the bioidentical hormone makes our life easier.
Yes, that's what I was my question. We offer them also bioidentical hormones,
Yes.
testosterone,
Yeah.
TRT as we call it,
Yeah.
right?
Yeah, and it's very beneficial for many men, either young or old, and also if it's combined with other therapy, like if he's having other problem and we need to other therapy, but he's always the testosterone, the fuel of his body will be like that.
Very interesting. If, for example, there is a reason for a man to think that there is some kind of prostate situation that he needs to address, then we can see that from the blood test, we can see that from the questionnaire, we can very quickly analyze and take precautions and take measures.
From some tumor marker like the PSA, and of course, we can offer him for a urology and functional doctor, and this will help a lot.
But as always, prevention is better than cure.
Yes.
So, ladies and gentlemen, we do encourage you, together with Dr. Nahla, do encourage you to come to us much, much earlier on. Don't wait until your symptoms are already there and so pronounced that it's actually interfering with your life, with your daily life. This is not the way to live. We can still live until 100, I do believe, maybe even later.
Yeah.
And in good health, in
a good
active health. And we have those role models in our life.
Yes.
So,
and we can see it every day in our clinic. And as I always tell my patient, God has created our hormones that come from the brain and affect all our body in different organ for a reason. So this means our body is connected. So don't treat your body and your hormonal thing as like the estrogen is only for fertility and for my uterus and ovary. It will affect everything.
Yes.
And testosterone is only for making man having sex or for making men having this voice or making no,
women have testosterone as well, and we absolutely need it too.
And yes, and our body works as a unit, and our hormones revolving around all our body, and every part of our body is affected by our hormones. So why don't we treat it like that? And why don't we take an action when we feel something like it's my hormone?
Yes, absolutely. And we wake up, ladies and gentlemen, we wake up with hormones driving us, and we go to bed with hormones taking us to bed. So,
Yes.
serotonin, melatonin, these are also hormones. These are neurotransmitters, but they're also hormones.
Yes.
And yes, so thank you so much, Dr.
Thank
Nahla,
you.
for joining us.
Thank you so much.
It was a pleasure of having you here with us.
Thank you.
So, we will talk a lot more in our
Yes,
next
we
podcast.
have to do that. Yeah.
Thank you,
Thank you.
and look forward to seeing you soon.